I'm a consultant dermatologist. My name is Martin Wade, and I'm here at London Real Skin to answer your questions about dermal filler. So using a dermal filler, and we usually use hyaluronic acid, it's the most common filler that we use, has a really important place for acne scarring treatment. It's often one of the first steps where we inject the filler into the dermis or the deeper tissues to help form a scaffolding and expand the skin where we've had volume loss. Putting this scaffolding in place can help the skin to then repair itself and iron out or soften textural irregularity and treat volume loss. Hyaluronic acid also has a very good hydrating property, and so it does really plump up the skin in a very nice way, which allows the skin to shine and look more healthy than before. Using hyaluronic acid filler injections is often overlooked in acne scarring treatment. It's usually one of the first steps that we use here if we have deeper scars or scars that have significant volume loss, because we really want to lift up the surface of the skin, restore that nice thick plump skin, and then think about more superficial treatments potentially to address the textural irregularity on the top of the skin. Even though the dermal filler that we use for acne scarring is not permanent, you wouldn't want this to be permanent. So it has a temporary role to stretch the skin, provide scaffolding for the skin to repair itself, and then as the dermal filler is being reabsorbed by the body, our skin is healing itself and laying down the normal skin components to repair the skin. So even though hyaluronic acid fillers are not a permanent structure in the skin, they do have a permanent effect. And so it's something that you don't need to keep having done on an ongoing basis. So it's often something that we might do once or twice right at the start of the acne scarring treatment. And then after that, it's done its job. We don't need to do it anymore.